for joining us today for our At Lunch monthly webinar. The topic today is on PCMH and what do you need to know about it. I'm going to give people about another minute to join, and then we'll launch into the program. Thank you. Okay, let's go ahead and get started today. I know we, some of us have our sandwiches and we're swimming in, and that's great. It's a great time to sit back and listen to the discussion on PCMH. Today we have some excellent panelists joining us, Dr. Liz Dewey and Justin Barnes. A little bit about them. Dr. Liz Dewey is a family physician in Greensboro, North Carolina, and she has been an avid user of EHR technology for several years, and she's been providing excellent insight and recommendations for the product functionality. She is also an advocate at PCMH and has been involved in the National Committee of Quality Assurance since 2011. Thank you for joining us, Liz. Dr. Dewey, we look forward to hearing from you on PCMH today.
And thank you for having me.
Great. And then Justin Barnes, who has become an industry speaker and knowledgeable in health IT. He is a public policy advisor and the entrepreneur in residence at ATDC, Georgia Tech's Advanced Technology Development Center. Also wanted to put in a little plug for him. He is launching a new radio program starting on Monday, which will be covering innovations impacting healthcare, technology, and entrepreneurialism in America. We also, thank you for joining us, Justin. It's good to have you here. Always good to hear from you, and I look forward to listening in on your radio program.
Thank you.
We also have with us Doug Swords, co-founder and vice president of RCM for Azalea Health. Doug has established the Azalea Health back office revenue cycle management program and has served with providing financial planning and leadership in Azalea Health. He brings a number of years of industry experience working with customers at all levels and scaling their RCM operations. Hello, Doug. Thank you for joining us today.
Hello, hello.
All right. So let's launch into this very quickly. The agenda for today is PCMH. Briefly, what is it and why is it important to us? What does a recognized PCMH include? Adoption of it in the U.S. Is there some proof that it's effective? How to become a recognized PCMH? Why you should participate? Do the requirements of participating outweigh the benefits? Is it the right time, and is it right for your practice to participate? Options for you not participating, how your technology vendor can support your efforts, and then we'll have an open Q&A session after that. I will be recording this webinar and sending out an email afterwards with links to resources and a link to the recorded webinar. Okay, with that, let's start with our first question. Dr. Dewey, I know you've been around this a lot more than I have. So briefly, PCMH, why is it important for U.S. physicians to know about it? Sort of briefly, why is it important and how can it impact their practice?
Yeah. Well, patient-centered medical home, being a family physician, to me it really helped reiterate what we do every day and the importance of it. So as their primary care doctor, we need to make sure we have good, effective communication with our patients. We're available to them when they're sick, available to them to do their preventative care and help coordinate care with other specialists as needed. And so it's a way of acknowledging that there's this quality care there for the patients and that we're doing a good job with our team, both within the office and the bigger circle outside the office, including the specialists that, that interact in the care with the patients.
Mm-hmm. Justin, do you have anything to add to that about sort of at a high level or maybe a national level? Why do you think the PCMH is important to physicians?
Yeah, I mean, I think Dr. Dewey covered a lot of the components, but I think the only thing that I would add is just from a strategic standpoint, as practices are looking at the future of healthcare for themselves and what they want to accomplish and how they want to ensure that they're succeeding in our ecosystems locally. I mean, you're going to continue to see more practices take on PCMH type strategies and navigate this new world around value-based medicine and accountable care. And PCMH is just a great way to start, a great area to start. It doesn't have the probably the high impact, quote unquote, that I would say that an ACO has, but it's a great way to kind of walk softly into these new payment models, and it's a great way. Certainly, if you're traveling down the path of meaningful use, stage 2 will position you very well to where PCMH is going, and also vice versa. If you've gone down the PCMH path, you're probably very well positioned to achieve meaningful use stage 2. So there's a lot of synergies there, and again, from a policy side, we work very hard to align in CQA with where we're going with meaningful use and also accountable care. So all these programs are becoming integrated. So I think from an initial standpoint, looking at, is PCMH important for a practice, or you as a care provider and you as a clinician, I would say certainly take a good hard look at it. It's not just for primary care anymore. We're moving into specialists and specialties as well. So I think it's very important to take a hard look at it. And I know that we're going to cover more components today, but I think from a starting point, people should be excited about the opportunity. There's a lot of incentives behind it, and it's certainly a good place to look and start.
That's a good comment, especially on meaningful use. And when you see here the traditional care, and what a lot of us have experienced is traditionally people don't have enough time with their doctor, there's a lack of communication with their care team, and there's difficulty getting access to information, and they really don't feel like they're fully engaged in their health care. And that's one of the goals of meaningful use and all of this is to help patients be more engaged in their health care. So for me personally, as a patient, I'm not a physician, I like seeing that this is being put into place to help all of us reach those goals and improving health care. Dr. Dewey, are you seeing that in your practice? Has this been sort of a good goal for you?
Yes, definitely. I think, patients want to know that their doctor knows who they are, and then their nurses know who they are, and that they're accessible to them. So yes, and hopefully that, like Justin mentioned, hopefully as we move towards value-based, we care about the quality, we get reimbursed for the quality that we do. So we can, with this model, potentially help keep patients healthier, keep them out of the emergency rooms, and have a cost savings there, and then have healthier patients in the long run.
And it's a constant balance, I think, and it to balance sort of the technology side, and as we see the coding and the regulatory side, but the bottom line is we're here to provide quality health care to our patients. So I believe this effort is really focused on that. Let's move on to then what exactly is a recognized PCMH? What is it comprised of? And then more specifically, the health IT domains that are help to create a successful PCMH. Dr. Dewey, can you go over some of that for us, please?
Sure. Well, yeah, so they've built, just like you can see on the slide, the foundation that they want to say. Again, they started with family medicine, looking at both our quality measures and making sure that patients have a good experience, and like you mentioned, feel empowered. And part of all that's made up of having a team take care of the patient, making sure they have access, and the electronic health records behind that. That's supposed to help us communicate better with our specialists, but also to be able to, run those reports, to take a look and to be able to see visit after visit, how are we improving with your different measures, whether it's your, your diabetes and your cholesterol, and to be able to actually measure that quality. That's something you couldn't really do with a paper chart. And then be able to give that to the patient and be able to look at ourselves and the quality that we do, and be able to have some quality improvement measures and put those in place to then do even better care, next time around, next month around, next year, whatever.
When I look at this, in my head I call it a community of care, because it's sort of as it says here, I'm more of a team approach is bringing all the care components together holistically.
Mhm.
Justin, anything to add to that, to what a PCMH is comprised of or what it includes?
Yeah, no, I think you covered all the highlights. I mean, you've got to have the essential technology foundation. You've got to just have the will also to want to, evolve and modernize your practice in the way that you practice medicine and coordinate care. So I think technically, the components are electronic health records and portals and personal health records and patient engagement and reporting are all critically important. But then, it takes the will, like Dr. Dewey, and physicians and care providers like her who are also strategically moving down this path and moving their practice forward. And I'm sure they're going to be very, very successful as they navigate the future of healthcare. But a lot of providers are not. I mean, there's people who are just choosing not to move down these directions. And so, I certainly applaud what Dr. Dewey's doing and what we're doing here today to try to educate other people and why it's important to navigate these paths.
All right, let's look at sort of a national picture, sort of a high-level perspective then, nationally. What states are sort of participating in PCMH adoption? Justin, can you kind of review this a little bit for us and maybe some of the significance of it?
Sure, and this is a pretty good map here to show a lot of the concentrations of PCMH, but this is not absolute. For example, Georgia right here says there's no law identified or legal authority is unclear, but a lot of practices and institutions are referring back to NCQA, to their accreditation in their program. So I think you're going to see pockets of PCMH, but every state certainly and every community is even handling this differently, and the incentives differ by provider. So and actually this is something that we're working on very heavily because NCQA is by far the largest doing the accreditation behind PCMH, but some states and certainly payers have gone on their own to create their own types of accreditation or programs, and we got to be careful with that because then when you start changing programs, like for example Azalea Health wants to follow PCMH and Dr. Dewey does, but if you have multiple different types of PCMH out there, it could be very difficult to coordinate care because standards could be different, ways we report could be different, and then we can't actually do our population health calculations like we need to in that kind of reporting at a higher level. So I would caution communities on going off on their own and really look to what NCQA has done. They're by far the leader. They've now moved into the specialty realm, outside of primary care. I think that's just very important that we look at what NCQA is doing. And if you're a payer and you're listening to this or you're engaged in this strategy, from your perspective, that you kind of look to what NCQA has done in your states. And I know that they are, but I think that in the next year or so, this map will all be blue, just because you're going to continue to see maturation, because it's just a natural evolution for for most specialties today. And I think all specialties over the next several years.
I think it'll be interesting to see. This was done in December 2013 by CDC. So that the new one's not out yet. So, like as you said, I think it would be a significant difference to see what's happened in a year. Justin Barnes, is it fair to say that as we move along and progress with this, that it may become more standardized because it's different for every state right now and every program and how they choose? But do you see this becoming more standardized in the future?
I do, and that's something that we've been working very hard on over the years of getting because CMS and HHS and other groups have been very good at creating programs, but they haven't in the past created a lot of programs to all be integrated. And so we've done a very good job getting HHS and CMS and even the ONC, all these governmental agencies, on the same page and working through the same programs. So when you qualify for one, you very well could qualify for 2 or 3 of the other ones, and you see that with meaningful use and accountable care and value-based purchasing. But to that extent, I certainly see that moving down the path with PCMH. Now, PCMH, quote-unquote, is not a government-type program, but it is incentivized, and they're certainly using government-type standards, and there's national accreditation. So I think you're going to continue to see more movement towards the standardization of PCMH, because that is what's going to lead to the population health management that we ultimately want to have to create a healthier population across the whole U.S.
Again, you bring up a good question, and I'm not anywhere near being an expert on this, but just from the research I've done recently, it doesn't really connect anywhere from what I've seen to meaningful use, but I think maybe it should, because a lot of these requirements for PCMH adoption are definitely involved with meeting meaningful use requirements.
Yeah, certainly meaningful stage 2. So yeah, and while there's probably no formal criteria, that there's probably some overlapping, but nothing's actually been called out and formalized. But I do see significant overlap with PCMH and meaningful use, and PCMH and accountable care, and those programs that are rolling out around that. So.
But yeah, it's a good thing to emphasize that physicians out there that are doing meaningful use, particularly stage 2, you're probably halfway there to patient-centered medical home. So, so keep going.
Yeah, that's right. Let's move on then to, is PCMH really an effective model? What sort of proof is there out there that this is the right direction to be going in? And I know that, Justin, you have some experience with this and some comments on that.
Sure. I think from a couple of different perspectives. Number one is I don't know if any PCMH physicians or practices that have said this is just a terrible idea or this is a terrible program. I personally haven't come across them. I mean, I meet the exact opposite, that, you know, while, and Dr. Dewey can speak to this much better than I can, but when you're implementing the PCMH objectives and criteria, and you're working towards that accreditation, there certainly are some hurdles, and there's certain, you know, changing workflows and strategies and best practices, and, you know, there's a lot of work. But once you get past that, then certainly everybody kind of really understands that, you know, we are coordinating care. Quality hopefully is increasing. Patients are engaged. Patients are happier. So there's just so many benefits that come with it, and then that's just the kind of the here and now. The next thing is you're actually very well, almost perfectly positioned to where the future of healthcare is going in new payment models. So you're going to see SGR, the sustained growth rate, reform come down in the next 2 years. You very well could see it. You're going to see it certainly introduced in the 114th Congress. There is a bill today in the 113th Congress, but next year it's going to come up again. It's probably a 50-50 chance that it'll get passed, but you're going to see some type of reforms, and what that means is providers are going to be paid differently. They're going to be paid for coordinating care. They're going to be paid for quality. They're going to be paid, you know, based on outcomes. There's still going to be a fee-for-service scale. It's not going to go away immediately. It's probably going to be a 3-year sliding scale for fee-for-service, and I don't think fee-for-service will ever go away. But the payments based on care coordination, quality, and outcomes is going to increase dramatically. And if you're doing PCMH today, you're perfectly positioned for that tomorrow.
Right, right. And Dr. Dewey, from your personal perspective in your practice and applying it, what do you think?
Yeah, I would agree that in the beginning there's a lot of things to kind of get organized and get moving, and again I would mention that if you've already done the work for meaningful use, you're probably more than halfway there, and there are usually things that we need to kind of shore up anyway as far as protocols with handling whatever calls or labs and communicating with patients and all that kind of stuff to help make your day more effective and efficient anyway. So in this day, you know, hopefully we'll be moving, just like Justin said, for quality-based payment, because in the end we spend our, you know, long days coordinating all this for patients, but we're still kind of in that fee-for-service model. So so yeah, hopefully we'll continue to improve. And once you go through those steps, then you're golden, and your patients are the patients appreciate it too. And I think that a lot of folks, you know, most doctors are in there we're in the business of caring for patients, so it all aligns with our mission. So it's just a matter of getting it all organized.
Thank you. Let's. I'm curious to hear about NCQA, the National Committee for Quality Assurance, and what is their role in helping physicians to implement and transition to becoming a PCMH? Who wants to jump into that? Dr. Dewey, I think you've been involved with them. Can you sort of introduce us to what that is?
Yeah, so they have a great, they help us go through the process. They have a great website that gives a lot more information. This is a good kind of there's a pre at the beginning, kind of a preparation kind of slide that mirrors this, and they can march you through how to prepare for starting PCMH, and then during this they're here to help you through every step of the way as well. The other resource, and there may be a lot of local resources depending where you are. There's area health education resources that can help the primary physicians and specialty physicians step through this as well. But yeah, they pretty much outline it step by step and give you the support and the tools and tell you how to submit all the applications.
They seem to have the methodology down, which I'm looking at and I said, oh, this is nice. It lays it all out pretty cleanly what you need to do.
Yeah, yeah.
Justin, have you had any experience with NCQA and their value in becoming a PCMH?
I think from a technology standpoint, just working with companies to become familiar with the recognition and the accreditation program and how to, what the technologies need to do to best support the reporting and certainly the workflows needed for NCQA recognition. So yeah, I mean, they're by far the best, and again, we're trying to push people in this direction nationally so they can look to NCQA for leadership in this area and follow the way NCQA does it, so then we all can kind of be more uniform. We all don't need to, continue to practice our own specific ways. I mean, we're all certainly unique, but we need to get to some strategies around population health management that comes from using some more centralized
some sort of
resources.
guidelines and parameters. Something I was wondering about the program, I know looking at sort of other business processes and methodologies, there needs to be a way to sort of sustain that once you implement it. Does this sort of include that to make sure you sustain it?
I feel it does, from my perspective, from what I've seen. But I mean, Dr. Dewey, do you?
Yeah, I would agree for sure. Yeah, and part of that, and there's lots of different. The Academy of Family Physicians, one of the things they do too. We have to every 3 years do some population management and some quality improvement studies with whatever disease state. So we might pick our diabetics and look at how well we're doing that. And so they have replaced, for example, every 3 years, you don't necessarily have to do that with the AAFP if you're doing it with patient-centered medical home. And so when we show that with our work with the PCMH, then we give that to the American Academy of Family Medicine as well. So so we're able to show that to the AAFP so that we can get basically credit for that.
That's great.
And it's we'd have to be doing it anyway. So again, it's another easy reason to kind of sustain it and keep it going. Yeah.
And that leads in nicely to sort of the next topic. Getting down to it, we touched on this already some, but as a physician practice, Dr. Dewey, why should practices consider becoming a PCMH recognized facility? What's in it for them and for their patients?
Yeah, well, I think that a lot of it is still, at this day, we can't say that there's a huge financial gain. We still think that there's the best is yet to come. So, again, first step would be to, get on the electronic medical record, and if you're doing meaningful use, you're halfway there. And, for me, I feel like the PCMH is basically a good way for us to document, what we're doing. So, one of the big things too, I'll just throw in there, is working with your EHR and your EHR vendor, because they need to help us pull together the information with what we're doing every day with our patients and make it easier for us to report and pull those reports together. So, for example, when you're trying to see how good a job you're doing with your blood pressure management or your A1C management, those where they collect the data needs to be in a place that's easy for the physician. So ideally, like right in the patient's encounter for that day, so you're not going in and out 3 different pages in and out of the patient's chart. So those are some of the big challenges, and I would encourage you to, as you go through this process, to communicate with your EHR vendor so that you can keep those things streamlined and help keep it in what's already your daily efficiency, so it doesn't become just another, another report or another more paperwork that you have to do. So the more we can keep it streamlined in our daily processes, the better.
Right, and that's a good point, and that's something maybe to discuss a little bit, is the importance of the technology factor behind all this succeeding, and how important having the right technology is to really implement this. Doug, are you out there? Can you comment on that a little bit?
Yeah, I mean, that's exactly correct. I mean, the first step is to decide, is this right for me and is this going to fit into my workflow? But then to be able to even participate and to reflect, like Dr. Dewey said, that you're able to meet these standards and recommendations as far as the coordination of care, you have to have the technology to show it. I mean, you're not going to be able to show these things using paper documents. So that has to be part of your decision-making process before I move forward with even trying to implement such a thing. How is my software going to be able to support me? Am I going to have the reports, the flow? Like Dr. Dewey's saying, can I get it out of the information in a certain way so I can analyze my quality clinical measure information without it totally taking up all my time and slowing my practice down? So, yeah, I mean, the health IT, the technology portion is a huge factor in determining whether you want to try to move forward with this or not.
Thank you, Doug. And this sort of leads into what are the requirements? And I have here sort of listed the 10 must-pass elements to become a PCMH. And I guess a big consideration for practices and physicians out there is this something I really should start considering looking into? Dr. Dewey, I know you, when you first got into this, that was probably a question for you. How did you approach that, and what was your conclusion?
Sure. Well, I'll tell you, that came around right around the time, 2008, when I was opening up a practice, and so it was kind of an ideal time, actually, to go ahead and, you're having to set up all of these processes anyway. So so for me, it worked out, quite ideally, because you have to address a lot of these things in your practice setup. So yeah, again, I guess I would just reiterate that we're doing it every day, and it never hurts to kind of step back and say, where am I? How well am I doing at this, and how can I do it better? And then the biggest thing is just, a lot of times putting it down on paper and making it a little protocol so that it's clear throughout the office how you're going to handle these things, and how the documentation, or in this case, faxes and phone calls, how they flow and all that, and getting it all written down and making protocols for the office, and which guidelines you're going to follow for different clinical things as well.
All right.
So again, once you do it, then you're golden.
Yeah, right. Justin, any comments on that, on sort of the benefits versus the...
Yeah, I think that, I can't imagine, I know certainly Dr. Dewey can speak to a lot of the requirements, and she's been successful with it, but I think the benefits far outweigh any of the requirements, because you've got to kind of look longer term and what it really positions you for in the future, and how it can help you collaborate or coordinate care and collaborate with your patients, which now are truly consumers. Patients have more choice than ever before, and so really looking out there and engaging them, and I think it goes back to even the last slide, and Doug brought this up as well as Dr. Dewey, is looking at the technology, and certainly it is about the workflow and the EHR and making sure you can get access to information and have the reporting, but then also the essential components of the outreach and the engagement with the patient and empowering the patient using technology, not phone calls and in office visits, but really engaging that patient using technology and some type of a portal where they can have access to their information. They can hopefully be much more engaged and empowered with that information, and maybe even update you and keep the medical record and the medication list updated with other drugs or prescriptions they have from other encounters and other providers. And just make, because I think you're going to see a huge, I already know you're going to see a huge uptick around patient-generated health data. And obviously that has to be reviewed by a clinician within your practice, but you're going to see patients, putting in, oh, well, my cardiologist gave me this script, or, my orthopedist gave me this script, and it's very important that you have a truly longitudinal medical record, and until we have all the interoperability in our communities, which is still, many years off in a lot of cases, having that patient be that resource is very important. So you got to offer them the technology tools as well.
Right, and it's empowering both the patients and the physicians to work together and providing quality care and getting quality care.
Mm-hmm.
Very true.
Okay, let's so I imagine there are probably people out there who just, here's one more thing I have to worry about and learn about, and is it really something I can do and want to do? Have you encountered any of that, Dr. Dewey, and how do you respond to that For example, I was reading an article and it said meeting the criteria can really tax resources. You have to hire additional staff, and they have to have additional IT infrastructure, and so on. So how do you respond to this?
Yeah, I think, well, in general, I think we're probably hiring more staff to meet a lot of our needs, documentation needs, and such. So yeah, I think in general, you do have to potentially have maybe another nurse on board to help you with documenting things and stuff, and we're moving towards that anyway for the most part. And for the IT part, I would say, again, that I lean heavily on my EHR vendor to help us with this, to help make it a productive venture here, and in the end, they're going to benefit from it as well. So, but yeah, for the most part, I think that in family medicine, it's been very positive, and so, yeah.
Now, what about, I know rural practices, do you think it's more of a challenge for them to find community resources to help them sort of develop that community of care? Sort of the collaborative care that's required to be a PCMH?
Yeah, well, so some of those things all kind of go back to some of the referral tracking and test tracking and following up and coordinating care transitions, and you can't do that without an EHR, or at least you can't be able to show that without an EHR. So typically the rural practices are doing it just like we are. They're just a few more miles in between them and their specialists.
Yeah.
But yeah, so it goes probably back to the bigger question of investing into the EHR and being ready to do that and making sure you make the right choice, because there's a lot out there about folks that end up in 3 different EHRs and for 5-6 years, and so having to start over with the EHRs is certainly taxing and expensive for sure.
I am going to jump on to the next question then, which is for those practices who are sort of in positions who are daunted by this whole, how do I approach this and what do I do? It is just not the right time for them. What are suggestions to sort of help them ease into it?
Yeah.
And I think number one is they need to sort of stay informed and see how it progresses. I think we saw a lot of change this year, and we're going to see a lot of change, as Justin mentioned. Justin, any suggestions for what else physicians and practices should be doing to sort of prepare to launch into becoming a PCMH?
Yeah, I think that certainly relating to the last slide and this slide, and you've got a lot coming at practices, and Dr. Dewey knows this better than all of us, but you're looking at ICD-10, you're looking at meaningful use, stage 2, you may be looking forward, or looking at least in the direction of meaningful use, stage 3, probably not looking forward to it, but looking in the direction of it. And then certainly you've got new payment models cropping up across our communities, and PCMH is just one of those. And so there's certainly a lot, but this is where you kind of take a step back and look at your strategic plan. What do you want to accomplish over the next 3 to 5 years in healthcare? And new payment models are going to come at you. And so I think it's just very important that you kind of look out with your partners, and then you guys begin to have those discussions. And because if you start taking them on one at a time piecemeal, they may not be the best integrated, and then you could have a lot of problems with workflow, or having just a disjointed office, or even really disrupting your practice in a bad way, or even your health system. So I think you got to kind of look at all of this holistically, knowing what you can tackle, having the right team members and the strategic kind of advisors in your camp, and you kind of look out over what you want to accomplish, what your team can accomplish. And Dr. Dewey just covered a little bit of it. They've added team members, and so looking for the right people that can support your mission, and then make sure it's all goal-oriented and goal-driven through timelines. So every month you're kind of doing a check mark, so everybody knows that they're making marked progress, that you've been up for ICD-10, you're ready for that, or you're up with PCMH, you're at you level 1 or level 2 or wherever you're trying to, or get to, and meaningful use stage 2, you've checked that box off, and you celebrate it as a team, because there is so much coming at you, but it's certainly you're able to cross these chasms, but do it as a team, mark your successes, and you're going to be extremely well positioned as these new models of care come at us.
You're right. That's a good point. There's these practices, small practices, any practice has a lot on them right now, in addition to patient care. Dr. Dewey, have you seen this at all, working this as a team as sort of a bonding experience, or has it been a good experience to reach your goals?
Oh, sure, definitely. Yeah, we share it as a team, and I think the patients see that too. So that's what what it's all about. But yes, definitely.
Yeah. And so, did you actually sit down and sort of analyze your capabilities to try to determine if how you were going to succeed at this? How did you approach that?
Yeah, so one of the things I use, so I've, again, kind of heavily leaned on, I have Azalea Health as my EHR vendor, and their reporting, and basically also I have a area health education center here in North Carolina, and they have some resources. So they have both meaningful use experts and patient-centered medical home experts that will basically help with the pathway and where you're at and setting the goals. And so we've used them and then us and kind of our timeline and where we're at with, we're relatively new to this EHR, and kind of having, just like Justin said, a goal of where we're going to be, what we're going to be using first, and what we're implementing first in those first couple months, and then where we're going to move to next. And so we have kind of that outline and that vision. So so again, like if you've got your EHR, first it's implementing it, using it accordingly, setting up your templates, getting familiar with the flow, getting patients introduced to the portal. Those are things that you kind of got to start in the beginning, and then you can move to, okay, the meaningful use, and then you can move to the patient-centered medical home.
And as you both have mentioned, it's so important to succeed at any of these initiatives is to have a solid EHR solution in place. Yes. And what are some of your recommendations to people out there, physicians, practices, looking for the right EHR solution to help them reach their goals? What should they sort of be asking? What should they be looking for? I know you mentioned reporting. What about like customer support and consulting? Do they have the right knowledge, industry knowledge?
Yeah,
sure, yeah. Go ahead.
Well, yeah, I guess I'll take first crack. I know that we all probably have a lot to say and advice, so I'll take first crack here and pass it around. But I think you mentioned, obviously having the right partner, because this is not about picking an EHR. This is about picking a true partner to navigate the future of healthcare with. So, because just one hurdle is ICD-10, another hurdle is PCMH, another hurdle is meaningful use, another hurdle will be accountable care after that, and value-based medicine. So it's just looking for not only the right technology, exactly, but that has experience in all these programs, and that they're, as a corporation or as a company, taking it very seriously and looking for best practices and bringing those best practices into your practice, but then also having the right user group setting so you can learn not only from your EHR vendor, but from your peers in the industry and certainly your peers in your community. So looking for companies that have those types of support structures and very strong customer support in general. And so I think those are the some of the highlights that I would look for. But going out there and looking for a company that has the experience, the expertise, the best practices they can hand off to you, demonstrate, and it could be through a multitude of either user groups or peer groups, or just training training journals and modules that they offer. So it really is about picking a partner and kind of navigating together.
Doug, can you comment on?
Yeah, from the vendor's perspective, you guys pretty much summed up a lot of what I was going to say, but what I like to recommend to the providers is to familiarize yourself with the standards. It's been mentioned a couple times that MU2, Meaningful Use Stage 2, if you're able to do that, then you're pretty much halfway there. If you go to the NCQA website, they have a list of standards, and they have it broken down by year. And it can be kind of confusing, but if you find the standards section, you'll see they're all pretty much related to the same. And they have a point system where they break down what's a must-pass standard and which one, how much points are allocated for which kind of standard. And so you need to kind of be familiarized with that. I mean, you take that to your vendor and sit down with them, like we said before. They need to be a partner in this and say, okay, this is what I'm trying to do. How can I get a report, or what module in the EHR is going to help me get these points or meet these must-pass standards, and then see what their response is. And if the software vendor is hesitant, or they say they can't accommodate all of it, find out, okay, where is it on their product roadmap? Is it something that is being worked on currently? What's the timeline for being implemented? So then that way you as a practice can decide, okay, I could probably go ahead and get started now, or maybe I should wait because my vendor's not ready, or is it time to switch vendors because they don't even have it on their horizon? So the NCQA website is a really good resource to finding out what exactly do you need to do from a technology perspective to meet the requirements, because there are going to be some financial incentives involved, and you need to know how the point system works and how that would integrate into your practice workflow and the EHR, so you can meet and get those points and see if this is something you want to try now or later. And then also, to go back a couple of slides, we were talking about how can a physician find other patient-centered medical homes. I was able to find on the NCQA website, there is a registry. So if you Google NCQA Recognition Directory, you could go and find other patient-centered medical homes in your area, and I'm sure you could call them. Probably several of them would love to talk about how they were able to achieve it. So I was just looking here recently, and there's quite a few of them in Georgia where I am, and you can tell some communities have a handful, like Rome, Georgia, of all places, has like 5 of them. So it's very surprising. But I think that would be also a good place to call up here and find out what they're doing. What EHR are they using?
That's a great idea, Doug. Thanks. Yeah. And also, a lot of these resources you mentioned, I will be sending out links to some of these in a follow-up email, and it will be in the presentation. This has all been a great discussion. I am looking to see if we have any questions out there so we can address some of those. First, quick follow-up. This webinar has been recorded, and we'll have that available on our website, and I'll be sending out a follow-up email with some of these links and resources around PCMH. Probably next week I'll get that out. But any other comments from you, Justin, or Dr. Dewey, about the PCMH and the value in general?
I mean, the only thing I would put out there is I would just congratulate certainly Dr. Dewey and the providers that have taken on the PCMH, and then certainly everybody, and applaud everybody who is researching it, because that means they're really looking out for their practice, they're looking out for their community and their patients, and they're really going to embark on a new future in healthcare, and it's only going to position you strategically and probably the very best for where the future of healthcare is going. So it's a great step, and hopefully everybody will begin to navigate it or continue to navigate if they're already on the journey.
Well, that brings up a question for me. Is there any need to educate patients about what this whole movement? I'm sure that not many people who really understand what it is. It's just one other acronym out there.
Well, I would say, I think my perspective would probably be different than Dr. Dewey's, just from a standpoint of, I would say that it is important to educate patients, and I think that, it's part of what I do in, my public speaking. I try to do as much of that as possible in social media and certainly through different keynotes and now the radio show. But I think that patients are becoming educated in a different way. They probably don't know about PCMH per se, but they're becoming consumers. They're paying more for their health care than ever before. They're engaging their health care more than ever before. They'll probably never engage it as much as we all want them to, but that's just human nature. But they are more engaged than ever before. They have technology. They are looking at how can mobile health and technologies like that enable them. They're actually proactively reaching out to their care providers, again in small numbers, but these numbers are all growing and more than ever before, to say, hey, what can I do? Can I get my prescription? Can I do my refills? Can I request an appointment? I can do all this in my banking. I can do all this for when I want to do anything else in my life. Well, I want to do this when I do I do health care, and I want to manage and maintain my health. Again, I'm paying more than ever before. So I think patients, as they become more consumers of health and again, take on more of the costs, they're going to continue to become educated in these areas. So that would probably be my perspective, but I'd love to hear what Dr. Dewey has to say from her
Yeah, I would
standpoint.
agree. I would agree with all that. Yes. They're definitely, I mean, most of the patients that we have that we introduce the portal and get on it are happy to use it and love using it and send us messages. So, and you know, the reality is it's easier to do that. It's a lot of times more efficient than, you know, sending a call and leaving a message and all that good stuff. And we can send all sorts of things back and forth. And we're able to communicate, you know, between the other specialists as well. And I can think of, I have a particular patient who, like you said, is very engaged. Probably, he'll send me pictures if something is going on. I've seen pictures, you know, all sorts of things through my patient portal, and that's great. I mean, that's the way, you know, that's the way it needs to be. We need to be accessible, and we need to be able to be there for them when they need us. So,
yeah, that definitely improves patient engagement, but they probably feel like they're getting more personal attention as well, and it's much easier to access.
Right.
I've got a question here. I think we were talking about this a little bit earlier about how is PCMH appropriate for specialty practices, and I know we had a question from a podiatrist, for example, and I think, Justin, you had some recent insight on updates on that.
Sure. You know, recently, I want to say in the last 3 to 6 months, the NCQA has moved PCMH recognition out into specialties, and so you know, obviously I applaud them for that. That was always on their roadmap, but it took them, you know, a while to get there. But you know, certainly the importance from their perspective was really managing chronically ill and really increasing care coordination and education and empowerment in that area with patients. So I think you know, we've certainly seen that, and that's had a good uptick. I think the specific question that we received is around podiatry, and unfortunately podiatry doesn't quite qualify right now, nor does optometry or chiropractors. However, I think you'll continue to see more specialties such as those brought in the coming years. I mean, they just got to kind of bite off, you know, bits and pieces as we go down, but you're going to continue to see upticks in this area.
Okay, great. That's good to see. And again, I think we're going to see significant changes this year and next year, and in the specialty practices in particular. Dr. Dewey, question, sort of more specific, what sort of benefits have you experienced from your participation? Now, I know you've touched on some.
Yeah, well, I think that for us, as feeling for me, that you could say benefits as far as setting up the practice and getting going. It's a motivator to help make sure you have protocols in place, to help make sure you have good communication amongst your staff and your specialists and your overall care team. It just kind of reiterates that, yeah, we need to be doing this every day to help our patients. I would say that you know, financially we haven't seen that yet. We kind of hope it's coming. We think that maybe it's helpful in negotiating with our contracts with the insurers. And as Justin mentioned, there's some, like Blue Cross Blue Shield has their own program, but you have to be PCMH first before you can get their recognition. So I guess there's still some, you know, some debate out there, like as far as financially, can you say right now if this has been helpful? You know, it's all about kind of positioning for what we think is coming down the road.
Right, and that's, you actually just brought up one of the questions we have, is sort of considering, Justin, maybe you can provide some perspective on this, both of you, is sort of the payers, the insurance side of all this. What sort of statistics are we seeing on their involvement and their perspective on it?
Well, it's certainly growing. It's growing very quickly, and there's a lot of us applying pressure in every community to payers, and you know, to not only to incentivize PCMH, because there's, you know, significant value to them in savings that roll up to them. Because I think when you look at all of these programs, the most savings roll up to the payers. It's not. It's not the patients. It's certainly not the providers, as Dr. Dewey would tell you. But it's the payers, and so they're naturally incented through financial gain to incentivize and roll out these programs. It just takes everybody a little bit different, you know, amount of time to understand them. How can, you know, they're actuarialists, so they have to look at these programs, understand how they can implement them and not lose money So, more payers every single day are rolling out these programs. And so what I actually advise practices to do in health systems is to ask their payers, what, either PCMH incentives or ACO or accountable care or care coordination, what incentives do you offer the community? Not what do I qualify for as a practice, but what do you offer the community? Almost what are you competing against? So that's something that I make sure that providers go ask their payers on a regular basis. I would say at least every every 6 months, knowing what is offered.
They're having to keep up too and change just as the physician practices are, right?
Exactly. Very true.
Excellent comments. I'm going to go ahead and try to close this out. I want to thank everyone in our panel, Dr. Dewey taking time out of your busy schedule, and Justin and Doug. Thank you for joining us today. I think it's been a really excellent conversation on PCMH. As I said, this has been recorded and we'll have it posted on our website. This is the last At Lunch webinar for 2014. We'll be launching a new series in 2015, so I encourage everybody to look for those new topics. And if you have an idea or suggestion for a topic, please send it to me. I'm Tamara Hyatt with Azalea Health.